Hey guys, I'm Melissa Kilcrease. I'm a nurse practitioner student at Auburn University, and I'm going to be giving you a short 5-minute lecture on stress incontinence. Stress incontinence occurs when muscles or other tissues that support the bladder or urinary sphincter weaken, which causes involuntary urine loss. It occurs on physical exertion with cough, sneeze, or exercise. It's more common in women than men, with 24 to 45% of women over the age of 30 experiencing some degree of stress incontinence. There are a number of reasons why these muscles weaken, one being childbirth, and this is simply because of muscle or nerve damage that's done during delivery. Women that have had a vaginal or forceps delivery are more prone than those who have delivered via C-section, and likewise, those that have had previous pelvic surgery, such as a hysterectomy or a prostate surgery, are more prone to episodes. Other risk factors include obesity, smoking, and any condition that can cause a chronic cough, such as COPD. So when these patients present, you need to be looking for any clues that could be contributing factors. You need to get a good health history, identify any underlying lung conditions, look at their medications, especially ones that they've recently started. These can contribute to increased urine production or even alter nervous system functioning. And some of these examples include Lasix or alpha blockers like Flomax or Cardura, which are often given for BPH, and even ACE inhibitors because they increase cough in certain patient populations. I would also assess estrogen status because estrogen deficiency can lead to atrial vaginitis, which can also cause stress incontinence in older individuals. Three key questions I would ask. First, when did the symptoms first occur? Have you recently had childbirth? Have you recently had surgery? Have you started a new medication? Anything that would point out to me as to why these symptoms began to occur in the first place. Secondly, I would ask, does it occur on physical exertion? And how much are you going at a time? This would help me identify what type of incontinence you're experiencing. And thirdly, I would ask, do you have any other symptoms, any burning or foul odor with your urine? Anything that would identify to me an underlying cause, such as a UTI or cystitis, that might be causing your symptoms. For my exam components, I would start with abdominal exam. I would try to rule out any masses, a distended bladder, anything that would lead me to think you have an obstructive cause for your incontinence. Secondly, I would do a pelvic exam. I would be looking for any vaginal atrophy, maybe a prolapsed bladder. I would do a bimanual just to test pelvic floor muscle tone and function. I would do a brief neuro exam just to rule out any sensory impairment of the perineal area. And lastly, I would do a cough stress test. And this is the most accurate clinical assessment for confirming the diagnosis, and it's simply where the provider observes urine loss whenever you have the patient cough or bear down. Common treatments include behavior therapy, such as Kegel exercises to increase pelvic muscle tone, healthy lifestyle changes, quitting smoking, treating the chronic cough, or even losing excess weight. Topical estrogen may be an option for older individuals who may be deficient in estrogen. Devices include a vaginal pessary. These actually support the base of the bladder. This is a good option for women who do not want surgery or are not candidates, but they do need to be instructed that they have to be frequently removed and cleaned. Another option for a device is a urethral insert. These are disposable devices. They're not meant to be worn 24 hours a day, but they can be worn during certain activities. Surgeries, the sling procedure is the most common, and this is just where the surgeon creates a sling to support the urethra with either mesh or tissue, and it can actually be performed in men as well. Teaching components. If they have a BMI greater than 25, I would encourage weight loss. Any extra pressure is put on the bladder will increase symptoms. They need to avoid any aggravating foods or beverages. Coffee, tea, anything with high caffeine is not a good option for these patients. And don't smoke. If they go out and about, they need to be encouraged to stock up on supplies. Put extra supplies in your purse. A change of clothes in the trunk of your car if you think you might need them. When you get to your destination, you need to scout out the bathrooms and seat accordingly, and that way you have easy access when you need to. And also take good care of your skin. Frequent changing of pads, clothing, anything to decrease moisture contact to that skin to prevent breakdown. So that concludes my 5-minute lecture, and I hope it gave you enough information to help you in clinic.